Okay, I got 6:01, so I'm going to go ahead and get started. Welcome, everybody, to today's EVV Town Hall meeting, which is our second Town Hall meeting for the month of June. We've been doing these since November, and I really want to tell you that I appreciate your time and input today. I know it's late in the day, and I really appreciate those of you who have joined us. We do try and do two presentations, one during the day and one at night, to accommodate people's schedule. My name is Brian Dowd. I'm the Deputy Executive Director over Policy, Operations, and Compliance at the Department of Community Health, and I've been the business owner for EVV for a while. We start all presentations at the Department of Community Health with a mission, which is to provide Georgians with access to affordable quality health care through effective planning, purchase, and oversight. Ooh, I was going to see if I can do that by memory, and I could. Thanks, Joe. So what are we going to go over today? We're going to do some status updates and timelines, talk a little bit about claim submission, talk about, give you a self-directed member update. That's one of the things that we've heard over and over again, that in every presentation, we need to bullet out self-direction. So we're accommodating that request. We're going to give you an update on key fobs and fixed devices. We're going to talk about common issues, give you that update on third-party vendors, give you the information for call centers, future town halls, and then do a question and answer period as much as we have time for. So where are we? First of all, I've gotten 3 or 4 emails this week saying, can I start submitting claims through EVV? Yes, the answer to that question is yes, absolutely, 100%. If you have a match claim, it can go through the NetSmart system, right on through to MMIS, and then you will have your normal RA that shows the claims processing. So please do not wait on claims processing. It is available. We also really want to emphasize that training is available, and we'll talk about that a little bit later. All the links are on our website, and Brittany will put it in the chat for you in the Q&A right now or soon. Sorry, I didn't mean to put you on the spot, Brittany, but you've done that before. So the training resources are available and they're ongoing. We encourage you guys to really attend those trainings and see all of them, the recorded trainings, the weekly trainings that are available. Make yourself available for those. Go back and listen to these town halls. They can be very useful. They're all recorded and put online. I sometimes go back to the presentations to look and see certain slides and see the information that we have put on. So please afford yourself of all the training resources, because a lot of the questions that are being sent into us are available online. Just another quick update is that you're going to hear me do my best to start calling Telus NetSmart, because Telus is now NetSmart. And so we need to make sure that we are calling them by their right name. I'm going to be honest with y'all, it's going to take me a minute, but we will get there. So where are we? We're still in that recruitment campaign point where we're getting a lot of questions, concerns, getting a lot of providers registered. And we are still walking forward to the July 1st, 2021 EVV mandatory for claims processing, meaning that all claims will have to go through the EVV system as of July 1st. Now, we, like every IT project, have a no-go decision on that, and we'll have that before the July 1st deadline and communicate any changes that we might have. But as of right now, we are absolutely moving forward to a July 1st implementation. Again, so claims can start today. If you're using the NetSmart State EVV solution, if you go onto our website or even onto this presentation later, we have 2 checklists that are available for you. The phase 1 checklist, which is about registering and getting started, putting in all your employees and that sort of thing. And then we have a phase 2 checklist for implementing the system, which is all about claims processing and all those second phase things that we want you to do. If you follow these checklists that we have available online, you will be in really good shape for when that claims edit becomes live and active. So I want to stop for a minute and talk about self-direction, because I've said virtually on every call, and I get probably 10 to 15 emails a day to my personal mailbox and the EVV mailbox, and that's probably an underestimate from self-directed members with questions and concerns. And one of the things that I've heard, and one of the suggestions I got was put something in every presentation about self-direction. So let me say this, I'm not limiting the communication to anyone. So if you are self-directed, we encourage you to participate in everything because you're self-directed. That's the whole point, right? You should know everything that pertains to the program that you are monitoring and managing. So we encourage you to be in everything. Now, will everything be relevant to you? Absolutely not. So if you don't want to participate, you do not have to participate in the larger town hall meetings. That we have set up very targeted town hall meetings by fiscal intermediary. And we did one specific monthly town hall, which is available online to self-directed individuals as well. So that whole town hall was for self-directed individuals. And we're also doing targeted self-direction or participant-directed town halls by fiscal agent. And yes, as you have requested, the fiscal agents will participate in the town halls. And as you also have requested, we are providing contact numbers on this presentation. So you got everything you requested. You got your own special town halls that are targeted to you. You got your contact information, which I know is crucial for you guys. And you also got their participation in those targeted town halls. So this will be available on our website as well. We really encourage you to utilize it and make those contacts as you see necessary. Now, the rest of this presentation will be about best practices, but it will not be targeted to self-direction. So you can feel free to stay on or leave and make sure that you watch the self-directed town halls. Again, those will be recorded and posted as well. So if the times don't work for you, they will be available for you. Okay, one thing we need to go over is key fobs. So we had initially, as part of our design, talked about incorporating fixed devices or key fobs for individuals that either didn't have an IVR, or which is a landline phone at home, or their workers did not have a cell phone. As we move forward with the project, we realize that key fobs and fixed devices are really no longer being used with the EVV solution. It was very old technology, and we really couldn't even talk to any states that were currently using a fixed device. So we really encourage, and for full functionality, that the employees, staff members utilize the app or an application on their smartphone in order to complete the EVV visits. There is an alternative. If there is no cell phone that is available, smartphone that is available to the worker, the individual or the provider for that individual worker can apply for the use of interactive voice response, or IVR, that telephone line in the house. And there is a form, and you can get to it right here or from multiple places on our webpage, where you can make that application and send it in. Now, I've had a few people who have contacted me and said, not only did none of the workers have cell phones, but the individuals don't have landlines. Now, I want to let you guys know we're auditing this. So we are calling members and workers when that is presented to us. I had one just today that was presented to me that the individual did not have any internet coverage at her house. When we investigated it, she had a cell phone with internet coverage. She had Wi-Fi available in her house. So we denied that request because there was no issue with Wi-Fi coverage. And furthermore, the last bullet is a Lifeline phone. So Medicaid members can get a free phone with free texting and free calling and way more minutes than they need in order to utilize the EVV application. So you can go to this website, or the members can go to this website for galifeline.com and get a free phone that they could use put it right by their front door or wherever else, so that when their workers come in, that they use their unique sign in and password, sign in and complete the EVV on that smartphone. So as an alternate to getting a key fob, we are now providing a free phone with a lot more functionality than you would with a key fob. Now, it's important to note DCH is not providing that. That is a federal program, but we have discussed it with that program, the Lifeline, the GA Lifeline people, and they are very excited about connecting to the folks who are in our waiver populations and providing this free phone service for them. So we want to go over a few common issues and questions. One of the ones that I continue to get over and over again is about your Medicaid IDs. So Medicaid IDs are issued not only by location, but they're listed also by services and waivers. So you may have multiple IDs for your agency. You may have a CCSP ID for personal support services and an ICWP ID for personal support services. You may have a comp ID and an ICWP ID, and you may have it for 4 different locations, which means you have 8 Medicaid numbers. So it's really important for each applicable Medicaid ID that you register that ID. Next slide, because I think there's more on the next slide about this. Okay, so that example is what I just talked about in the first paragraph. It's also important to note that you need to know your zip code for each location that you have registered, because that is an important indicator for registration. We have to have the current zip code. You can go on to MMIS and put in your provider ID in the reference file, and it will bring up what your zip code is for that ID. I've done it for people myself now since yesterday when I said this on the town hall. Somebody called me today and wanted to walk through it, and I was able to walk through it with them. It's very important when you set up these IDs that you make sure your short name makes sense. You wouldn't want to put Brian's PSS Agency 1, Brian's PSS Agency 2, Brian's PSS Agency 3 as your different ID names in the administrative portal, unless you just have a fabulous memory and you can remember what waiver that is associated with and what location that was associated with. I would want to put in ICWP Lilburn versus ICWP Savannah. So I knew where the location was and what the waiver category was for the administrative portal. But you guys probably have even better ideas than me about how to make those short names. So we also get a fair number of questions about prior authorizations. So it's important to know that prior authorizations are automatically loaded for MMIS. So when those PAs come in from Beacon or from Alliant or wherever they're coming in from, they feed into MMIS and they go straight into Telus. Usually overnight they go into Telus. Now, employees will need to be added either via manual entry or imported once you register. You got to get your employees in. If you have data that is incorrect or not showing up, you need to call the EVV call center. Now, we'll give you that information later. A lot of you guys are writing the DCH EVV mailbox and me personally, and that's fine if you do that, but it's important to know that that's going to slow up your own process, because all I'm doing with it is forwarding it to the call center and giving them a chance, and I'm copying you when I do that so you see it, and affording them the chance to follow up with you, enter a ticket, and resolve your issue. That also helps us track what the common issues are, making sure that you're responded to and that it's not a systemic issue, whether or not it's a training issue, whether or not we have a system issue that needs to be addressed. Also, data access varies by role. Roles are assigned by the administrators. If you have a role other than an administrator, you are not like a super user and you don't have access to all the agency data. If you are the only administrator for a location and you change your administrative designation to biller, you will no longer have full access. So you will lock yourself out of that super user and you will not be able to change it back to administrator. So you need an administrator for each location. So always make sure that you have one of those for each and every ID. Otherwise, you're going to have to call the call center for support to get that reset. I think the next slide is we wanted to go over some to let you know what the roles are. So that administrator role is, again, that super user, the person who can do everything. The biller allows the user to access claims functions like visits, work list, claim review, prior authorization. But it's not the super user that can assign roles and that sort of functionality. There's a personal support aide. That is the actual worker. That allows them to view only the information and schedules for the recipients for which they are working for. And then there's a provider view only. This role allows the user only to view information. And you can't also be a personal support aide and a provider view only, because the personal support aide has to do that clocking in and clocking out. There's a lot of functionality they have to do. All right, I'm going to pause here and turn it over to Joe Schnurr, who is the Chief Customer Officer for NetSmart, and let him go through a task scheduling demonstration. Take it away, Joe.
Okay, hey, thanks, Brian, and good evening, everyone. So like Brian said, I'm going to give you a demo. So I'm going to stop sharing for a moment while I pull up my demo system. And while I'm doing that, this demo applies to all providers that are using the NetSmart application for EVV. What that means is if you're using a third-party system to collect your EVV data, then this will not apply to you because you are going to use tasks in your own EVV system. Okay, so let me pull up this site. See if I can get this to work. Okay, can somebody confirm that you're seeing the dashboard?
Yep, we see it perfect.
Okay, great, thank you. Okay, so if you're a provider and you've been in the NetSmart dashboard, if you're an administrator, then you're probably familiar with this view. And if you're in charge of setting up the tasks for each service and you need a refresher on how to do this, of course, this is all available in the training. But if you need a quick refresher, I'm going to walk through it with you and show you how easy it is. So first, on this menu bar on the left-hand side, I'm going to get down to where it says Provider Agency. I'm going to click on that. Across the top, you're going to see Details, Payers, Contractors, Override Rates. So I am going to select Payers. All right, I have it logged in a couple minutes, so it booted me out, made me re-sign in. Okay, back to Payers. I'm going to select Georgia DCH as my payer in this example. And I'm going to page down, and then I'm going to see the list of services that are available to me through this program. Now, remember, this is a demo system. So if your system looks a little different than this, that's because it's set up for the specific program. This is just set up for demo purposes. So in my demo here, what you see is 4 different services, and you can see the names here. And you can see that some of them already have tasks set up. So this home health aide service has 7. Personal care has 4, and these other 2, they don't have any. So what if I want to add tasks? I click on these 3 buttons over here on the right. When I do, this little menu opens up and it says manage tasks. So if I click on that, it will bring me to this screen. So I clicked manage task for this service code, which is the home health aide. And as you can see that there are, as I page down, there's a whole list of tasks that are set up in the system. So you will see tasks that are set up as defaults in your system that allow you to just select. So you don't have to go and create all your own. So we try to do some of the work for you. And you can see in my list, I have 64 listed here. And the ones with the boxes checked, those are the 7 that were already selected. And you can see as I page down, you can see which ones they are. And all the way down to 64. Okay, now if I want to add one of these tasks, so we'll just pick managing finances here, this box, I just select the box, and it's that easy to now add this task to that service code. Now, if I want to save this change, I do have to page all the way down to the bottom, and I do have to hit the save button. And when I do this, I get this little green bar up for a minute, just says that the task has been updated. And that's as simple as it is to add, or even if you want to delete, if you want to remove, you just uncheck the box, come down to the bottom, hit save, and you've just now removed that one task. So very easy. Now, if you want to create your own task, so you go through the list and you say, oh, I have a task that's not on the list. You can click this little blue button here. It says add, and you can put in your own description of what you want the task to be. You hit save, and now we'll add that task all the way at the bottom. It will add it as my number 64. You can see somebody actually did add in here custom task, just as an example. So that's you can use that feature if you want to add your own tasks if you don't see one on the list. So hopefully that is pretty easy for you all to be able to add tasks. And then once I do add my tasks, when I'm going to schedule a visit, so I just clicked on this schedule, and I hit this little blue arrow here, or this little blue plus sign in the upper right, says add new visit. And for those of you that have added visits before or went to training, you're probably very familiar with this process. You just select your member. It will automatically pull up the information for that member. So you can see that Betsy here is a member of Georgia DCH. You can see that she has this Medicaid ID, these diagnosis codes, and I can select my aide for this visit. And then in step 3, I actually select the service that the worker is going to provide in this visit. And you can see that here is that service code, the home health aide, and you can see there's managing finances that we added as a task. So when if this is the service that I'm providing, I select that service, and it automatically will select all the tasks. Now, if you say, well, in this specific visit that I'm scheduling, well, we're not going to do the laundry, or we're not going to manage any finances, then I could just unselect those. And then the visits or the tasks that are selected, those are the tasks that will come up on the mobile app for the worker when they clock into the visit, so that the worker knows which tasks they're supposed to provide during that specific visit. So again, the tool makes it very easy for you to add or subtract tasks, create your own tasks, and then select or deselect the tasks during scheduling. All right, I will go back to the presentation. Give me a second.
Joe, while you're going back to the presentation, is it one administrator per location ID, or can there be multiple administrators?
There can be multiple administrators. We do not limit the number of administrators.
Thank you. That was one of the questions that came through, and just thought we could go ahead and knock it out while you were switching back to the presentation.
Yep, makes sense. Okay. Are you seeing the presentation?
Thanks.
All right, let me go to the next slide and back to you, Brian.
Great. So another functionality that we had discussed with you guys was offline mode. And it is true that the system can be used in an offline mode, and that can be used up to 12 hours without Wi-Fi or cellular if the person is in a very remote location or doesn't have access to cell service for whatever reason. Maybe they're in the mountains or whatever else, right? If that is the case, the system can go into offline mode. But it's important to note that your staff will need to sign into the application before it gets to a place where there is no cell coverage. So if they know that a house or a location where they are servicing the member has no cell coverage, they need to sign in from their own house or from the local Quick Trip or from the street down the road where there is cell coverage, and make sure they do that before they get to the specific location. I think that's it for that one. Retroactive billing. We've gotten a lot of questions about what about PMAOs, which is those folks who maybe are out there with QMB, or which is qualified Medicare beneficiary, or some other type of Medicaid, and then they go on to the waivers, but they're not active for waiver Medicaid yet. If you have a prior authorization out there, even if it's not active and the member is in the system, you can still schedule a visit. The visit just won't match until you have an active PA. If the person is completely unknown to the waivers, they're not out there anywhere, we don't have a waiver PA to have brought them over into EVV. We don't know that they've ever been an EVV individual because they're new to the waivers and they're new to getting the services. So we have to wait for the Division of Family and Children's Services or others. It's really just the Division of Family and Children's Services in this scenario with PMAO to approve the waiver case. Then that information will come across with the PA to Telus, and then you'll be able to retroactively go in, enter the visits on the administrative portal, and get paid for those past periods. Another question that I get frequently is, I've got a third-party vendor, right? I'm out there and I'm not using the Telus solution, and my third-party vendor is integrating with Telus. Do I need to register for the Telus solution? The answer to that is yes, because you're going to need to have that administrative capacity for claims console. So you need to start your registration process now. And again, online and as part of this presentation, we have 2 provider checklists for you. So if you go in and pull out these provider checklists and you follow them step by step, you will be fully prepared for using your third-party system. Okay, this is the call center information I told you about before. It's very, very important that you are familiar with this call center information. And again, it is online. If you go online, you can see it. The number is 1-833-701-0012. There's an email that is right there. I've probably copied it 100 times this week, probably way more than that, to be honest with you. And then there's a website for chat as well. So let's say you want live chat. You don't even want to send in an email and wait. That is also an option that you can go to. We have a cheat sheet additionally on the DCH website, the EVV website, that you can go to and pull down that will give you who's the best person to help and to get you help and give you all of this same information. So what's upcoming? Again, we have our targeted fiscal intermediary participant direction meetings, one tomorrow at 6 o'clock with Acumen, and then next week with Continuum and Public Partnership on Tuesday and Thursday. I believe that's the right dates. Then in July, we will be doing an open Q&A as well as August. We're going to see what's most important to you guys, and we're going to target the presentation to that. So please do keep track of the schedule of events on our EVV webpage. I've sent that out a couple of times to people this week too. Okay, so we've got some questions in the we got one question in the EVV mailbox about this today. So I'm going to use your question as an example. So thanks for sending it in. You wanted to basically know what is the status of your third-party provider. You know, can we start submitting claims to Telus? And the provider you provided is in the in pilot section. So they're not yet in production, but they are in pilot. So they are very close to full production, and they should be able to submit claims very shortly when they get into production. I would encourage you to circle back with them and ask them if they are now ready to submit claims or if they need to submit claims, if you need to be one of their first people to submit claims if they haven't already. So please go back to them and ask that question. Right now we have one third party in full production. We have many more that are piloting and many more on top of that that are in testing. We have others that have contracted with us and started the development process, which means they're working out all of those connections so they can start testing. There's a fair number of those. Then we have 1, 2, 3, 4 that have contracted, but as of yet, we haven't really started forward with the development and testing process. And then we have 3 more that have done a little bit of initial contact. Finally, there are 1, 2, 3, 4, 5, 6, 7 that have just flat out, they said they have declined integration. They're not interested in integrating with the state of Georgia. So if you are using their third-party systems, you need to have a conversation with them immediately, because you're going, if you want to continue on going to get paid for CLS and PSS services, you are going to either need to use the state solution or you are going to need an alternate EVV vendor that does connect with the Telus system. All right, we're at the Q&A. I do want to give you the DCH mailbox as well. Again, I'm going to encourage you for your specific issues, if it's not like broad questions or concerns or policy issues, to go to the call center mailbox first. But this mailbox, evv.medicaid@dch.ga.gov, is available for everybody. I was out of the office last week, but by some small miracle, I was able to catch up with all the EVV emails prior to this presentation. I think there were 14 more when I signed back on and looked at it right before this presentation. But there were many more than that, and they have all been responded to in the EVV mailbox. So I will be getting back to you much quicker than I was. Sorry for that week delay. All right, let's talk about the questions. So I already answered 2 questions. So I'm going to go on to the next one, which is really more of a statement that says, do not understand how billing will from July be done from Telus, knowing fully well providers and CNAs are still trying to get the process working. is somebody is not live by 7/1/2021, how are they going to bill the missed visits? So first of all, I want to be clear that the person, the folks that, and it's not one person, it's a leadership team that makes the decision on whether we go or don't go 7/1 is not Telus or Conduit. They are a contractor to the Department of Community Health, just like you providers are a contractor to the Department of Community Health. So just like we make policies and turn off and on provider IDs, it's the same thing with any of our contractors, right? So the decision lies very much at the Department of Community Health. We are thoughtfully looking at every single thing that comes into the call center, that comes into my own personal email, phone calls. We're looking at all of it, and that will inform our go, no-go decision. I will be clear. There will be a claims edit at, if it's not 7/1, it'll be pretty close after that, as soon as we can be assured that the issues that are being presented to us are not system issues. They are in fact training issues or user error. So I've walked through a lot of things with folks, and I've seen quite a few issues that are just training issues. There are things where there's a misunderstanding about the way the system works. But of course, we're going to be very thoughtful about that 7/1 date. We're not out to just not get providers paid for things that are our issue. The next question is, do we have to enter member data and service data if you're using a third-party software? You need to circle back with your provider on that. They're the ones who, I get a lot of questions about what the third-party systems are doing. And I know the Telus system, but I don't really know the third-party systems. The next question is, I see my PSS service codes, however, and not my adult day center service codes via Telus. That's fabulous because we don't do adult day health in EVV. So that means it's working right. You shouldn't see your adult day center service codes. You should only see your PSS service codes. Only PSS is required for EVV. And then again, we have the question, can you have one administrator for, oh, that's the flip side. So can you have one administrator for multiple locations? I believe the answer to that is yes also. That's correct, right, Joe?
Yes, it is.
So like I could be the administrator for 5 different IDs, right?
Yes, and I saw an email earlier this week about, do I have to use a different email? And the answer is no, you should use one email so that you only have one account. Then you can easily flip back and forth between your different locations. If you register and you're using a different email every time, now you're setting up multiple profiles and you're not going to be able to use the system properly.
Thanks. That's a really, really good tip. So the next question we got in is there a set distance a caregiver must be within a client's home in order to clock in and out effectively, 50 yards, 100 yards? I've been asked this question multiple times this week. And there is a geofence that is associated with EVV. Will I tell you what that geofence is? No. Nope, not going to tell you. Because the system is not prevented for use by geofence, right? We understand at the Department of Community Health that people frequently have services that start or end in the community. So there's nothing that stops you from signing in and signing out at a location that is other than the member's home. What we use the geofence for is data analytics. If the employee is consistently clocking in on the middle of 285 for somebody that lives in Cabbagetown, we're going to have questions about that because that doesn't seem to match up, right? But you should not worry about what the yardage is for geofence. We also understand that GPS can sometimes be off by as much as 100 yards. And that would not trigger anything that was weird to us. We are not at the point, nor would we ever be at the point where we would be like, aha, they're at the end of the driveway and not in the house. That is not the purpose of this program. So that is not something you should really be focusing on. As long as your employees are clocking in when the service starts and they're clocking out when the service ends, and you're notating that task, you have absolutely nothing to worry about as related to EVV. The next question is, if I have two separate IDs, folks, if you could put your questions in the Q&A and not in chat, that would be awesome. If I have two separate provider IDs, one for source and one for CCSP, then I will need two different emails as my ID. I think that is correct. Correct? Joe?
Two different emails.
When you register for your IDs, not when you're assigning administrator. Do you need separate IDs for the separate emails for the different IDs?
No, you do not.
Okay, so no, you don't even have to have separate emails for your IDs. So that's not correct either.
That's correct. You can use one email because basically you're setting up a profile as your as the first administrator. So we want them to use the same email.
Correct. Okay. Does the ICD-10 code cover all ICD-10 codes for the member diseases? It should. As long as they're loaded into the MMIS system, it should. We don't use unspecified codes in MMIS. I can tell you that because I'm the medical policy guy, right? So sometimes I've gotten some questions where it's like, well, why is this code not valid? And I'm like, it's not valid for anything in MMIS. So if you have questions about that, you can feel free to send it into this email box, the EVV Medicaid email box, and we can get our medical policy folks to check on it. The next question is that you use a third party for documentation of services. Now Telus provides a documentation piece. So I got several questions yesterday about basically that were, why do I need to document tasks? And I want to be clear, because you should have always been documenting tasks. It's a policy provision that is associated with the Part 1 policy manual for all of Medicaid. And I got a little concerned about it yesterday and even a little sharp because we're about to fire up auditing again. And I am very worried that we have home and community-based service providers that are not putting in the tasks and not saying what they're doing in their service units, which would lead you to an audit exception. We provide billing, we reimburse for actual services, and we need to know what those services are, not just check in, check out, CLS delivered. So if it's not in your TheraP system or whatever your third-party system is, and you're not capturing it on Telus, you need to make sure that you're still manually capturing that. Okay, hold on one sec, because I got to go down more. Are there rounding rules? There are rounding rules. We have a meeting with the Medicaid chief tomorrow to discuss the rounding rules, and we will be putting out further guidance about the rounding rules next week. And that is associated with billing to exact time, just so everybody has the information. The next question is, Structured Family Caregiving Program had to register with Aide Care for EVV who declined to work with DCH. Yeah, that I don't have any control over your relationship with third-party vendors. And we don't require EVV for structured family caregiving. We only require it for PSS and CLS. So I don't have any control if you're out with a third party. That's outside my scope of ability to do anything about. We just contract with the Telus system, and you're welcome to use the Telus system for EVV at no cost. If you set up with two different emails, call the call center and discuss that with them. They'll walk you through what you need to do. if you want to change, call the call center. I believe I mentioned earlier that the other town slides are available for our review. If true, where can we find it? Well, first of all, it is true. It's very, very true. And it's on our DCH website, which we have been putting all of them on since November. So if you go, and here's the way I get to it. I'm going to give you the easy way I get to it. I go to Google and I put in DCH EVV GA. The very first thing that pops up is the EVV website. You can click on the provider tab and the member tab and scroll down, and every single town hall presentation is there. Every single time we've done a town hall presentation is there, along with all of the slides. These aren't up yet that we're doing yesterday and today, but they'll most likely be up by the end of the week or early next week.
And Brian, those were actually posted today, so they're available right now as well as yesterday's recording.
Great, awesome. So we're really ahead of the game than we're used to. The next question is specific to public partnership. I'm going to ask that you tune into that town hall specifically to get that information. Yes, you can call the call center, Ms. Lamb. Call the call center to make changes. How do I register my aides? Each time I try, I get my agency name. What am I doing wrong? I think you probably need to go through the registration training again. And Brittany, if we could put up that resource so to go through it, because it has a walkthrough, and you can also again call the call center. And I've had a couple of people do that where they're able to walk them through and get them started with the registering each of the aides and getting them set up.
Of course.
I'm sorry, what?
Sorry, I just said I'll post that in just 1 second.
Thank you, Brittany. I know I'm just randomly calling on you to do stuff, and I apologize for that. There is another question that says you have a third-party vendor, but you want to move to Telus. That's totally at your discretion. We sponsor the Telus system, so you're able to move over at any time if that's what you choose to do. I want to be clear that it makes me no never mind and the department no never mind either way. We have an open model system, so you're allowed to do either, but we do want to afford you the opportunity to do either one if you think it's better. Okay. Let me make sure there's nothing else in the chat. There is stuff in the chat. I think I've answered everything except should we continue to aides to fill out timesheets? I think the best way to answer that question is anything that is captured in the Telus system does not also have to be filled out on timesheets. So if you're doing your scheduling on a timesheet now and you start doing it in Telus, you don't also have to do it on paper, because when we audit, all the auditors are going to have access to Telus to look at the information. We've already are in the process of setting that up with our program integrity unit, right? Also, if the signatures there, which we have for the aide and the provider, for the member and the aide, then you don't need to have it on a timesheet. You don't need to document tasks if you're checking off and you got the tasks on the system. That's a whole bunch of manual work that is taken away by the EVV system. Okay, I think that ends all of our questions. Again, the EVV mailbox is open for those questions, and you can also, again, call the call center or utilize the call center for those training resources and the walkthroughs. They're really, really good at walking you through all that information. I also want to really, really thank everybody for their time and participation today. I appreciate all of your input and your continued input to myself and others associated with the program. It is invaluable. We could not make this federal mandate work without your input. So thank you, everybody, and I hope you have a good night.